Hello and welcome back, and this time we want to take you through the elusive cranial nerves. Man, these cranial nerves give students such a hard time. Even when they get them down, it's like they knew them last quarter or last term, but you ask them this time and it's like, ooh boy, I think on old Olympus and to touch and feel and all this other stuff, they don't remember it, right? And this stuff is not bad. Trust me, it really isn't. So let's use some study smart strategies and lock this information down, okay? Here we go. First, cranial nerves 1 through 6. So what are we doing? Helping students see through larger concepts, and I am Cliff Davis, Associate Dean and Advanced Medical Surgical Professor. All right, so I'd like to throw some questions at you, all right? So what is the total number of cranial nerves? And how many are there? Okay, there are 24 cranial nerves. That's right. Let that soak in. Some people hearing that going, what? Yeah, 24, because there are what? 12 pairs of cranial nerves. A lot of students miss that piece. They hear 12 all the time. 12 cranial nerves, like, yeah, there's 12 cranial nerves on one side of the brain, one hemisphere. But then there's the other side, right? 12 pairs of cranial nerves. Let's take a look at them. Okay, so what I have here is this picture for you to be able to see that, right? See the olfactory, right? Cranial nerve number 1. But you see it here on one side, and you see it what? On this other side. So everything that you have in terms of your cranial nerves, what's going on? They are duplicated or repeated on this other side. Right, 24 total. Be careful of that on the exam, right? Okay. All right, now, what I want you to do, you know the drill. You know what I say? Have a piece of paper handy you watching my videos, daggone it. Okay. All right, so now what I need you to do, write down the first 6 cranial nerves. Go. Right? You don't have a piece of paper. Fine. Put it in your phone. Something. All right? And pause the video if you need to. All right. This stuff is easy. I'm going to show you how easy it is. All right, now. First things first. This is the best way to learn those cranial nerves. And as we talk about what were the answers just a moment ago, what I want to point out to you is that the answers are right in your face. Literally. Literally in your face. What do we have one of on our face? One nose. And what's the very first cranial nerve? Olfactory. Right? Olfactory, the sense of smell. And this numerical face is a great way to learn your cranial nerves. The other great way is to learn how to assess each one. So sense of smell, what will we use to test that? It's funny you ask that question in class and it's an alcohol pad. Like, no, don't use an alcohol pad, right? Get some coffee or some cinnamon or something pleasant, right? Yeah. So anyway, a sniff test to test the olfactory. So that was 1. But then what do we have 2 on our face of? 2 eyes, right? That's the very next one. Optic, right? The ability to see. And what do? We measure visual acuity. Now, that's fancy medical and nurse speak for going to the doctor's office and looking at the eye chart with the giant E on it, right? By the way, what's the name of that chart? The name of that chart is the Snellen chart. Yes, yes. By the way, a little bit of insider information. So it's the Snellen chart, and how far away is it? How far away up against the wall? 20 feet. Then that makes what? 20/20 makes sense. Okay, that's why it's 20/20 vision. That chart is 20 feet away from where the patient's vision is being measured. And what line on the Snellen chart represents 20/20 vision? And it's funny that that line is what? 8. You turn the number 8 sideways, and what do you have? A pair of glasses. Right. Line 8 represents 20/20 on the visual acuity. All right? Good. Number 3, oculomotor. If you notice this 3 up here, we're going to come back to that. But when we say oculomotor, if you were watching the last video with neurological anatomy and physiology, right? Motor means what? Muscle movement. So that oculomotor controls a lot of muscle movements in the eye. Most of them, by the way. Okay? Number 4, trochlear. All right. I know, I have students that who came up with these terms, right? Okay. Well, trochlear. Super easy. Make it easy, right? How many wheels on a pickup truck? 4. Trochlear. And by the way, 4 and 6. So say this with me if you would. 3, 4, and 6 makes the eye do tricks. Let's do that again. 3, 4, and 6 makes the eyes do tricks. So what is that saying? 3, 4, and 6 make up the muscle movement of the eyes. And we're going to get deeper into that. Just in case you get tested on it. You will know it. Okay. Number 5, trigeminal. Now, what I want you to do is notice that number 5 is interesting that it's made like a little watermark in this, right? Number 5, what letter does it look like in the alphabet, that number 5? It looks like a giant letter S, and that's exactly what it is. It's for sensitivity in the face, right? Okay? Now, this is a point where it would help you to learn about disease processes to actually understand this better. So, there's a disease process, and let's see if you can think of the name of it, where the patients have intense pain in their face. When a fan or something's blowing on their face, or they pass under an air duct, or in some cases when people just step outside and the sun hits their face, they have to cover their face up. What's the name of that condition? That condition is trigeminal neuralgia. Algia, what? Pain, right? Trigeminal neuralgia. And what's going on with that? Let's break it down further. So, trigeminal, that's a nerve that comes across your face and it breaks into 3 branches when it comes across your face like this, right? And for some people, those nerves can be inflamed and super sensitive. And that's when a person suffers from trigeminal neuralgia, okay? Yeah, sensitivity. And then 6, we said was a part of our 3, 4, and 6. But what I want you to notice is that that word abducens. Abducens has the root to the word abduct. Abduct means to what? Move away from the middle. Move away from the middle and move towards the side. Right. So abducens in this case with this eye would move my eye what? Towards my ear. Abducens. But here's the tricky part. That was this eye. But then abducens here what? Would move the eye the opposite direction towards the ear. Abducens. Yeah. All right. So here we go. So olfactory. So I've got a picture of an old factory there, right? An old smelly factory, right? An old factory, okay? So yeah, sense of smell, olfactory. And yeah, we're good there. All right, number 2, optic. All right, our second cranial nerve, vision. And we said we had what? 2 eyes in our face? Optic nerve. And by the way, remind me, what instrument did we use to assess that? Snellen chart. Good. Oh, wait. Let's take that. All right, let's keep running with it. So that was a Snellen chart. And Snellen chart measures what? Visual acuity. Excellent. Okay. On to number 3. And what do we say? 3, 4, and 6 make the eye do tricks. So that's good. But now I want to make a special note here that 3, 4, and 6 have to do with the muscles in the eye. But I want you to realize that 3 does most of the work. So when it comes to moving the eye in different directions, 3 does most of the work, right? Does more than 4 and 6. And when we're looking at the pupil in the eye, whether it's dilated or constricted, that's also determined by 3. By the way, if we are shining the light into a patient's eyes, right, and we're checking out their motor response, what is that assessment test called? It is a Perla examination. Good. But now, on your papers, write down what Perla means. All right? So, and people usually rattle that off. Pupils equal round reactive to light and accommodation. Yay, right? Let's say that again for people who don't, maybe don't connect with it. But pupils equal round reactive to light and accommodation. Great. Perla. Perrla. All right. 3, 4, and 6 make the eye do tricks. All right, now, what would this be referring to? So notice that the eye is going to move in these different directions. So if we take our marker or our pen, right, and we ask the patient, don't move your head, but with your eyes only, follow my pen or whatever I'm using, right? And so they move their eyes in these directions. What is that part of the assessment called? It's called the 6 cardinal points of gaze, right? Or the 6 cardinal points, so however you want to say that, but 6 cardinal points of gaze. Now, here comes a slightly trickier part. Sometimes you don't see it on the exams because it's a little bit higher level, but look, you're watching RN Cliff Notes. We're going to do this thing the right way, huh? We're going to teach you that too. So, there's a cranial nerve responsible for each one of these directions or movements of the eye, all 6 of them. A cranial nerve is responsible for them, and you're about to completely know and understand what that is. So, here is the secret to that. And, right? But I want you to realize, what did we say earlier about eye movements? What cranial nerves? 3, 4, and 6. Notice, let's go backwards. Notice where I put the 6. And the 6 looks like what part of your body? Like a part of your ear, like an outline of your ear. So, 6. Does anybody remember what the name of 6 was? Abduces, right? What? Sending your eye out in a movement towards your ears. Great. Now, here comes the other one. 4. Got to get that one together. 4, what I want you to realize is that the number 4 itself sort of looks like a nose, right? If you draw a number 4, it kind of looks like a nose sticking out, depending on how you draw it, especially if you draw it this way. So here's what I did with this. I took 2 number 4s and I pushed them together to make them go ahead and look like a nose, facing in both directions, right? So you can kind of see it outlined here. 1 4 is facing that way, 1 4 is facing that way. So, when we're talking about the movement of the eye down towards the nose, that's cranial nerve number 4. How about movement of the eye out towards the ears? That's cranial nerve number 6. And by the way, all the rest of the movements are cranial nerve number 3, right? Yeah, so we got 6 out towards the ear, we got 4 down towards the nose, and what? 3, 3, 3, and 3. Right. Now, that explains why 3 is the only one that gets the name what? Oculomotor. Why? It does most of the eye movement. It does most of the work, including pupillary response. Right? Good job. All right. So now, looking back, so we said eye movement towards the nose, what? Cranial nerve number 4, right? Trochlear, pickup truck, 4, towards the nose. 6, abducens, eye movement towards the ears. Great, 3, 4, and 6. All right, now, earlier we made mention of trigeminal neuralgia, and I wanted you to be able to see what that nerve actually looked like instead of relying on my fingers, right? All right, so you see the 3 main branches, and what I did is I took a letter S that kind of looks like a 5 and put it on this gentleman's face, referring to the sensitivity, and he's having the pain in his face, right? And what was the name of that disease process again? Or that condition? Trigeminal neuralgia, right. All right, guys, so that's cranial nerves 1 through 6. No problem, right? Okay, thank you for tuning in. We'll see you next time.